Dear audience, good afternoon. Let me introduce my progression in my PhD thesis in the last 3 months, titled Association between Fluid Therapy and Organ Dysfunction in Critically Ill Patients. My name is Ildikó Szántó. I'm a first-year PhD student and an anesthesiologist and intensivist in Nyíregyháza, and I have a personal vision in my work to use in everyday clinical practice science-based fluid therapy to improve better organ functions. And to achieve this, my mission to optimize therapies for critically ill patients through tailored fluid strategies. We currently have 2 similar ongoing projects to investigate the effects of balanced crystalloids versus isotonic saline on organ dysfunction in patients undergoing major surgery and in septic shock. Let's see the common background of these topics. Fluid administration is essential in hemodynamic stabilization. For this, we use in the first line crystalloids. There are 2 main types of crystalloids, the balanced and unbalanced solutions, such as isotonic saline. The main difference between the 2 solutions is that the concentration of chloride of isotonic saline, which is about 50% higher than the concentration of chloride, the balanced solution, or the concentration of chloride in blood. This excessive chloride intake can be harmful for the patient, causing arrhythmia or metabolic acidosis. Let's see our first topic, which is investigating the effects of balanced crystalloids versus isotonic saline on organ dysfunction in patients undergoing major surgery, which is a systematic review and meta-analysis. There are about 230 million major surgeries in a year are associated with a relatively high complication rate. And we know that during the surgery, it is essential to maintain normal volemia, as both hypo and hypervolemia can lead to organ damage. And guidelines are agreed that fluid therapy is essential and that the crystalloids should use as the first choice. But we don't know whether the balanced or unbalanced solutions are associated with better clinical outcomes. That's why our aim to investigate the effects of balanced solutions versus isotonic saline on postoperative complications in major surgery. Our clinical question is perioperative fluid therapy with balanced electrolyte solution more beneficial than isotonic saline in preventing postoperative complications? Our primary outcome would be the postoperative complication rate defined as Schweizweder and co-workers, and we hypothesize that using balanced crystalloid is superior to isotonic saline to decrease postoperative complication rate. We conducted the systematic search at the 10th of November last year in the 5 main databases with this search key, and at the end of the selection process, we ended up 29 full-text eligible articles. We finished our analysis for 2 main postoperative complications and some secondary outcomes, and there are further analysis ongoing, as you can see on the slide. Let's see our results. In the first slide, you can see the results of cardiovascular postoperative complications, such as cardiac arrhythmia or need for vasopressor therapy treatment. These are very important for us because both of them could be life-threatening, so we want to this risk as low as possible. In this analysis, we can include 6 articles. All of them were RCTs, and we investigated about 10,000 patients. The between study heterogeneity was 36%, which is a low heterogeneity, and the overall risk ratio was 0.83 in favor of the balanced electrolyte solution group, which is clinically and mathematically significant. On the next slide, you can see the difference in the intraoperative chloride level change between the balanced electrolyte solution and isotonic saline group. In this case, we can include 15 RCTs with about 900 patients and very high 89% heterogeneity, which is considerable due to the different patient population and different study settings. You can see that the overall mean difference was about 60 millimole per liter higher in the isotonic saline group, which is clinically and mathematically significant. And to importance this finding, we was tested, which you can see on the next slide, the difference in the intraoperative pH level between the 2 groups. In this slide, you can see 14 randomized controlled trials with about 800 patients and also a relatively high heterogeneity. The overall mean difference is 0.053, which is statistically significant, but the magnitude of it can be only considered moderate. However, we can say that isotonic saline can indeed tend to cause hypochloremic metabolic acidosis. On the next slide, I would like to emphasize our previous findings. On the slide, you can see the normal scale of pH level, and I hope you can see, if not believe me, that only 1/10 of change in this value can cause acidosis or alkalosis. On the left side of the picture, you can see the intraoperative shift in pH level, and you can see that the change in isotonic saline group are more pronounced than in balanced electrolyte solution group. On the right side, you can see the change in the chloride level changing, and you can see that this change in balanced electrolyte solution group is hardly changing, but in the isotonic saline group, this change is well below the 0 line. And these results can profoundly affect the fluid-infused amount. And in this analysis, we included 13 articles with from RCTs from 800 patients. And you can see that the overall mean difference is only 50 milliliter between the two groups, which indicates that which may explain the relatively small changes in chloride and pH levels. We continue our analysis further to other effect relationship with the fluid infused. Our clinical investigation strength is we used only randomized control trials and relatively high patient numbers, but also we have limitations such as we have different study settings and a very high heterogeneity of the population. Our data suggests that balanced crystalloids can reduce postoperative cardiovascular complications. That's why we suggest for clinical practice that using balanced electrolyte solution should be the first choice, especially in patients high cardiovascular risk. But further studies with homogeneous population would provide better evidence. Now we are doing the risk of bias assessment. And briefly on the second topic, which would be also a systematic review and meta-analysis. In this case, we would like to investigate septic shock patients. This patient number is very high in the intensive care units, and the main problem is that despite the improvement of healthcare, the mortality rate remained very high in this population. According to surviving sepsis guideline, we have a weak evidence level to using balanced crystalloids, but we don't know how fluid type influences organ dysfunction. So we want to determine how balanced crystalloids versus isotonic saline affect organ dysfunction in septic shock patients. Our clinical question, in this case, does using balanced crystalloids decrease organ dysfunction compared to isotonic saline? To answer this, we use PICA framework, where our patients will be septic shock patients. We compared balanced electrolytes with isotonic saline, and our primary outcome would be the development of organ dysfunction based on SOFA score. Our hypothesis is that using balanced crystalloids is superior to isotonic saline and is associated with a decrease in organ dysfunction in septic shock patients. And based on this, our clinical implication would be that using the most appropriate fluid can decrease the incidence of organ dysfunction. So summarize my aim, I would like to submit my first paper in August this year and the second in September. And I would like to thank for your attention with the quote from my favorite actor, Bud Spencer: "Challenges are not for you to win, they are for finding out what kind of person you are." Thank you for your attention.
Thank you very much for your talk. I always find it very interesting that receiving crystalloid fluids is the most basic thing in a hospital
Yes.
treatment. Every patient going to a hospital receives an IV line,
Yeah.
and there is very low quality of evidence compared to some, I don't know, cardiology cases with 40,000 papers.
Yeah.
On these are the what is
We like
important to science.
With your slides, we can see the elevated chloride level is a very dangerous thing.
Yep.
What are the side effects of elevated chloride level? What is the reason why this situation is very dangerous to our patients?
Thanks for your question. The most, or the biggest problem is that the high chloride level can causing severe metabolic acidosis in these patients. And the other big problem, which perhaps you can see on the slide, that can cause cardiac adverse events, especially cardiac arrhythmias. And because of the patients are older, rather, these patients have high cardiovascular risk, and any cardiovascular complication and arrhythmia can be very harmful for them.